So we were talking about ossification and talked about the different kinds of ossification. So types of ossification we have are intramembranous, which is the replacement of dense layers, dense tissue, connective tissue, with bone. And so essentially it's a mesenchyme, it's a stem cell type thing. So the flat and irregular sesamoid and sutural bones are formed this way. And so they eventually become a spongy bone sandwich. So you can see like this is compact bone, and this is spongy bone. And then you also have compact here. So that's what we see with a lot of these flat and like the bones that make up the skull, the irregular bones like your vertebrae and sphenoid bone and ethmoid bone that are just kind of irregular shape, and the patella, sesamoid, and the sutural bones. So that's how those are formed. The other type is endochondral, and this is what happens when you replace the cartilage with bone. And like you saw in the previous video, if you watched that, about the bone healing, when a bone breaks, it becomes a soft callus, which is basically cartilage, and then it becomes hard callus, which is bone. And that's endochondral ossification. So when it comes from cartilage, hyaline cartilage in particular, and it makes bone tissues, that is endochondral. Chondral refers to cartilage. And the long and short bones are going to be formed this way. So it's more of a lengthening of the bone that is going to occur here, not the appositional growth, which is widening of the bone. This is lengthening of the bone. So you don't have to really know all these stages, but you start with some sort of a primary ossification center. It's like a bony collar and the periosteum. And then you have a secondary ossification center at each end. So there's going to eventually have one at each end. And that starts to get some blood vessels to it. And then you have your cartilage being converted over into bone. And so it spreads out from that central ossification center. So this primary ossification center is going to make your bony collar and periosteum. It's the vascular tissue invades, and you get your primary bone marrow, your marrow cavity at the diaphysis, and that eventually is going to be all bone instead of cartilage. And your secondary ossification centers are going to be at the ends of the bones, and then they will have a epiphyseal plate here that forms at this where the bones are kind of coming together. So you have your primary ossification center going out, and then from the center this way, and your secondary ossification center is going this way and out this way. These are going out this way. And so at the point where those two ossification centers come together, that's the epiphyseal plate. And the adult bone then would have spongy bone at the ends and compact bone in the middle that makes the medullary cavity. So you can see the fetal skeleton, it's a lot of cartilage, and you can see these spaces in between the cranial bones. These are called fontanelles. They eventually will replace with bone, but there are some cranial bones in the fetus, but then it eventually becomes fused, and you have your sutures and things, but it doesn't completely finish this until after the baby is born. So there are some soft spots. Those are the fontanelles. So even in a child's x-ray, you can see that epiphyseal plate has not closed because they still have growth to do. So substances that affect growth, the growth hormone stimulates bone growth. It affects the three things it affects. Growth hormone affects skin, muscle, and bone. And so obviously this is going to have something to do with overall development and bone tissue. Steroids will also stimulate the maturation of the bones, especially during puberty, and they close those epiphyseal plates. So that's like the end of, you're not going to grow any taller at that point. So substances that affect bone tissue development also include T3 and T4, which stimulate metabolism and healing. So when you have a break in your bone, vitamin A, which is going to help produce the glucosaminoglycan, the GAGs, and I said that carrots have a lot of vitamin A, and I don't like carrots, so like GAG, glucosaminoglycans. And then the vitamin C, collagen, is what it's going to help to do. So T3, T4, metabolism and healing, the vitamin A, glucosaminoglycans, and vitamin C, collagen fibers. Calcitriol here is going to be involved in the synthesis and action. They are basically going to absorb calcium and phosphate, and that's going to increase calcium in the blood and phosphate. And so bone reabsorption also in the bones, and calcium in the digestive system, reabsorption in the kidneys, and absorption in the digestive system. Let me start that slide over again. Let's erase. Okay, so calcitriol, what it's going to do is it's going to stimulate the bone builders, or the bone, it's going to stimulate the osteoclasts, which are going to release calcium from the bone. So it affects the bone. It also affects reabsorption in the kidneys. So instead of losing calcium, you reabsorb as much as you can, resorption. And then absorption is in the digestive tract, especially the small intestines, but somewhat in the stomach as well. So calcitriol starts in the skin, and there's some stimulation from sunlight, which then converts things into other parts that eventually becomes calcitriol, and that's the finished calcitriol. But it's all of this is about bone reabsorption and absorption, and so it's going to increase calcium and increase phosphate blood levels, so in the blood. So calcitriol, or is also called vitamin D, so it's showing you some of the things like in the digestive tract, absorption by the digestive tract, the blood into the bloodstream, and then the deposition is done by calcitonin, so that decreases calcium blood levels. That's what calcitonin does. Calcitriol and PTH are going to do the opposite. They are going to increase calcium in the bloodstream by reabsorption, and also in the filtration, instead of filtering it, you're going to reabsorb a lot of it in the kidneys because of calcitriol and PTH. So it also helps to reduce loss in the feces, so that you have more reabsorption into the bloodstream. So calcitriol is a form of vitamin D. Think of vitamin D, you have to put it in milk to help you absorb more of the calcium. So it increases absorption of calcium into and out of the bloodstream as necessary. But it acts by increasing calcium absorption in the small intestine and increasing resorption from the skeleton. Calcitonin does the opposite. It's going to lower blood calcium levels, and it's going to work with the osteoblasts to increase the number of osteoblasts and deposit calcium into the bone tissue. So that's going to decrease the calcium in the blood. If you're putting it onto the bone, there's not as much calcium in the blood. And osteoclasts are also inhibited while osteoblasts are stimulated. Parathyroid is going to do the opposite. It's going to increase blood calcium levels, and it's going to do that by stimulating osteoclasts to break down It's going to stimulate osteoclast activity, inhibiting osteoblast activity. So, inhibiting osteoblasts and stimulating osteoclasts. So this is going to increase calcium in the blood. So calcitonin, this pathway is going to decrease calcium, and this pathway with calcitriol and PTH is going to increase calcium. That's what you need to remember. So calcium absorption, again, by the kidneys, as well as the loss of calcium in the kidneys, is reduced. So here's the negative feedback loops. If you have excess blood calcium, then calcitonin will be secreted to reduce the osteoclast, increased osteoblast. So you have less bone reabsorption, more bone deposition. If you have more, and that should then return the blood calcium levels to normal. In the negative feedback loop, where you have a decrease, you have a deficiency, you want to increase osteoblast, reduce osteoblast, so you won't deposit as much, and you will reabsorb as much as possible. Resorption increases. But you also have less of the phosphates are excreted and less of the calcium is excreted because it affects the kidneys as well. And so that also leads to increased calcium blood levels. So osteoporosis is when the bones get brittle, and that is affected by levels of estrogen in the bloodstream. And so that's what you have, decreasing estrogen as you age, and so that's going to lay down. Estrogen has some effect on bone density. If you have enough estrogen in your body, you're going to have a higher bone density. If you have too little, then you get these kind of big gaps in the bone, and it's going to be brittle and break down. So that's the end of this section.